Good day, everyone, and welcome to today's episode of the Healthy You Talk series, where we hold meaningful conversations and engage experts on matters concerning our lives and that of our families. Today, I will be your host. My name is Titi Adesanmi, and we'll be diving into a very vital subject, your child's health and you. As parents, caregivers, guardians, loved ones, families, we know that our greatest responsibility is ensuring that our children grow up healthy and strong. With the rising concerns, common illnesses everywhere, we know that it has become very difficult for us to, and that's also very overwhelming for us to keep up with our child's health. And that is why it's very important for us to talk about this topic today. And today I have an expert with me. It's my absolute pleasure to introduce Dr. Titi. Dr. Titi, it's so good to have you here, Ma. Thank you for being on the Healthy Youth Health Talk series.
Thank you.
So I'll just read a brief profile of Dr. Titi. Dr. Titi Adesanmi qualified as a medical doctor in 1995 and became a consultant pediatrician by 2001. She's a member of the West African College of Physicians and a fellow of the National Postgraduate Medical College of Nigeria in pediatrics. Her distinguished career spans from faith-based, public and private healthcare sector across various regions of Nigeria. Passionate about holistic child healthcare, Dr. Titi extends her advocacy beyond hospital into communities, schools, creches, where she has trained staffs and parents in over 30 educational institutions across Lagos on various child health topics. She is also a regular guest on radio and television programs, offering expert insights on a wide range of child health issues. Some of her featured appearances include immunization in children at Echo FM, nutrition in children at the Amazon Show on Air, Why Is My Child Not Eating on Doctors on Air in Classic FM, Cancer in Children on Classic FM, and Cough in Children on Unilab FM. Currently, she serves as the consultant pediatrician and medical director at Lifefort Children's Medical Center in Surulere, where she manages a wide array of pediatric cases. She's also a co-author of key pediatric textbooks used in medical education across Nigeria. Dr. Adesanmi is married and a proud mother of 3. Her approach to pediatric care combines deep medical insights and compassion and clarity, qualities every parent can relate to. Dr. Titi, thank you so much for joining us today.
Thank you. Yeah, it's my pleasure. I'm glad to be here.
Okay, so talking about today's topic, but before I go into today's topic, I want to just say that you look gorgeous.
Thank you. It's so cute.
Thank you so much, Dr. Titi. Okay, so today's topic is my child's health, your child's health and you. This is a very important conversation that we want to have today. And also, being the fact that today is Children's Day, and it's very important for us to talk about issues affecting our children. So let's start from the base. Let me ask you, Dr. Titi, when we talk about child's health in today's world, what exactly are we referring to?
Thank you very much. So, child's health is not just the absence of disease. Child's health means that this child is well, the overall well-being of that child, the optimal state of well-being of that child. So it's not just that this child does not have a fever, does not have a cough, does not have a catarrh. We're talking about the child's emotional well-being, the child's physical well-being, the child's mental well-being, holistic, the child's spiritual well-being. So we're talking about the well-being of the child as a whole when we're talking about the child's health. And all of them are interconnected. So, maternal absence, for example, abstract as it sounds, can just be the reason why a child is eating but is not gaining weight. So there is a link between all of them. So when we're looking at child's health, I'd like us to understand that it's not just a physical complaint, but everything that has to do with that child's well-being.
So in other words, child health is holistic. In another word, we can say well-rounded. Because
Yes.
it talks about emotional well-being, physical well-being, and and in all areas. Oh, okay. So I want to ask. We live in a society where social media has become the doctor of so many people. Technology has taken over the hospitals. And it's like everybody, before you get to see a doctor, you want to ask Google, you want to ask ChatGPT, you want to find out what the diagnoses are. So my question is this. So what effects does it have? And how does it also affect the child when parents do these things?
That's very good. So, first of all, I think that we can help parents, which is what you're doing, and I'm so glad for a program like this,
Thank you, ma'am.
by giving parents the right kind of information. Because people will go to ChatGPT, Dr. Google, because they're looking for information. So if we, in the health services profession, give them that information ahead, they won't have to depend on Dr. Google or ChatGPT. So that's why I'm very happy that we're doing this. So it's important that parents have information and they get information from the right sources. The dangers in consulting ChatGPT, Google, is that sometimes the information being provided is not quite accurate for the particular locale where that child is. It's not quite relevant for that particular child in that particular community at that time. So, whilst it may be relevant for child A in location A, it will be totally off for child B in location B. So it's dangerous really to depend on this modern
Technology.
I'm telling you,
To take the place of a doctor.
it's really dangerous. We really should be talking to the people, to the trained people who are around us. Talk to your doctor, talk to your nurses, they are in a position to give you correct information for your environment. And part of the challenge with depending on AI, Google, ChatGPT, when it comes to your health or your child's health, part of the problem is that you might be delaying onset of taking the right kind of action. So it's important that please, when we have questions, ask the people around you who know, because they are more likely to give you the information that is contextual for you.
And relevant at
Yes.
that time. In a way, you talked about prevalence of certain illnesses in certain locations.
Yeah.
It's very powerful because some of these people, they take information that is meant for another country,
Correct.
and then they bring it into their own country,
Correct.
which might not be
Correct.
relevant.
Correct.
For instance, so this is not directly related to what we're talking about. We know that fibroid is prevalent in Black women.
Yeah.
So just imagine a Black woman who has fibroid and is trying to get information from the Caucasians. It might not be
You're even going too far. Let's talk about malaria.
okay. Yes.
Malaria is not a problem with the Caucasians.
Yes.
So it's a problem
Yeah.
in Africa. It's a problem with us here in Nigeria. So even the people in the village can make a diagnosis from malaria. But the Caucasian will take them a long time
Yes.
to be able to arrive at that diagnosis.
Yes.
And delaying diagnosis leads to delay in treatment. So that's what we're saying, that diseases are, location specific.
Yes.
So it's important to get the right kind of information from the experts in the
Wow.
location.
Thank you so much, Dr. Titi. That was very profound. So viewers listening to us, you now know that the health of your children does not lie on Dr. Google. So look for the nearest hospital close to you and look for the nearest expert around you to talk to. So Dr. Titi, the next question I want to ask is a question I get to hear every time. And it's this. Parents come in and they say, because my child went to school, my child got down with fever, with catarrh and cough. So my question is this: what is the cause of these recurring illnesses in children, most especially children between age 1 to 5?
Yeah, I hear that question as well. As a pediatrician in Lagos, I hear it all the time. Oh, doctor, when the children were on holiday, they were not sick. But once they go to school, after 1 week, it's one problem or the other. And I feel for the school owners. So let me take it from that point. It's a coincidence of events. It's like teething. When a child is teething, so a lot of times that would be the same time that the child will start running a temperature, or maybe throwing up, or maybe having watery stomach, that's diarrhea. And then people will say, oh, teething makes them to have watery stomach. Teething makes them to vomit. Teething makes them to have fever. All of that are false. They are just events happening at the time that teeth eruption is also happening. Why is that so? Because when the children are erupting teeth, the gums are very itchy. So they put anything and everything inside their mouth to rub the gums. Now that anything and everything that they put inside the mouth are filled with germs. It is those germs that make them sick. So those germs will give the fever, will give the diarrhea, will give the vomiting. So it's a coincidence of events.
So this is like a revelation for me to be able to say, because I've always thought that when children are sick, that it literally comes with fever. In fact, I think my elder sister, when she came to take care of my baby when I had my first child, so she kept saying, oh, there's going to be a time when the teeth will start coming out and the child will, fall sick. So you have to, there are some plenty drugs you used to buy there.
Yes,
this is really a big revelation.
No, it's just coincidental.
Wow.
So now, thank God you can relate to that, and I'm sure many parents can relate with that.
A lot of parents will.
So you can see that coincidence between teething and fever and stooling and vomiting. In the same way, when children resume school, a lot of activities are going on that are coinciding with that time that's making the children ill. So it's not the fault of the school. Let me be an advocate for the schools. It's not the fault. And I'll tell you what are these things, because information is power.
Mm-hmm.
When I tell you what those things, because for example, in the case of teething, now that I've told you that it is objects that have germs that's causing the problem, we now know that in that period, we'll keep as many objects around the child as clean as possible. So that even if the child puts those objects in the mouth, they don't have so many germs that make the child very ill. So in the same way, certain things are responsible. For example, when school resumes, leaving the house early in the morning is a stressor for the under 5. In some parts of the world, children don't go to school until they are 5.
In some parts, until they are 6.
So to make a child that's less than 5 go to school, it's already a stressor. And anything that stresses anyone, adult or child, reduces the person's immunity. Once immunity is reduced, any sickness can jump on the board and complicate the picture. So, because when they are going to school, you have to wake them up earlier than usual. Then, rush them, the school bus comes to pick them, or you drop them. And then, so that whole going to school is a stressor. And that reduces immunity, makes them more susceptible. That's reason 1. Reason 2, when they're in their house, the number of people they're interacting with is minimal. But when they go to school, they're interacting with a larger number of people.
The teachers, other children from
Exactly.
other homes.
Now, all of us carry our own germs that keep us healthy. So, my germs are in my body that are keeping me healthy. Yours are in your body that are keeping me healthy. But by the time I'm under 5, whose natural immunity is still being built up, now suddenly comes in contact with so many germs. Maybe in the house it comes in contact, let's just assume, just 10 people with their 10 different
germs. So normal flora.
There are 10 different packets of germs, as it were, and then suddenly a child goes to school, he comes in contact with 100 different packets. I mean, that's a lot.
That's a lot.
For a child's immune system, it's just being built.
Yes.
So, stressor is there, then the exposure is greater. And remember that this exposure is not cleanliness of the school we're talking about. It's the human flora, the germs that live in people. We cannot get rid of those because that human flora is keeping us healthy. As I'm talking now, there are germs coming out from my mouth.
Yes.
As I'm talking. That's why it's dangerous when a newborn baby is born, you want to talk, you are talking over the face of the baby. You are just donating all the germs from your mouth onto the face of that baby. You know, so it's not really, so the under 5 comes in contact with lots more germs when they start going to school than when they are at home. And those germs, remember, we're not talking about environmental cleanliness. We're talking about human flora from the various people interacting with. That's another major reason. Wow. The third major reason is that you cannot really control the child's activity when the child is not at home.
Yes.
Case in point, children like to play on the floor. Anyway, okay, so we're always keeping the floor clean. As you know, maybe in the school they are mopping the floor 3 times or 4 times a day. Maybe in your house they do the same. Okay? And then there are things dropped on the floor. They will pick those things and they put it in their mouth.
That is depositing germs into their system.
So, and they will collect their friend's toy that their friend has put in his or her mouth and put in their mouth as well. So we can see that there are a lot of activities that are responsible for this. So with this information now, if you ask me, if you really want peace of mind for your under 5,
don't take them
don't
to
take them to school.
But is that possible in Lagos? Because Lagos is a very busy place, and not just Lagos. A lot of young parents now are trying to make money.
Well, but you see, the good thing about it is that there's distance working. There's remote working.
Yeah, because so maybe they
so with that now, a lot of young parents can consider one parent doing remote work for a while.
Yes.
So while working remotely, you can have a reminder who is there. You know, people are afraid to leave their children with reminders at home alone. And I appreciate that. But if you can work remotely, then the reminder, the child reminder means that, oh, Oga or Madam is around. That puts a bit of check.
Yes.
You know, so that's that thing about they go to school, they're always ill, it's surrounding events. Another thing we can do, okay, so we cannot keep them at home. If you cannot keep them at home, then look for a school that's near the house.
Okay.
So that you don't have to wake the child up at 5 a.m.
to go to school.
In 5 minutes.
So proximity becomes a solution.
Yes. So look for a school that the child can wake up at 7 o'clock.
Yes. And meet
and
leave
the house at 7:30.
Yes.
And get to the school at 8:45. You know, so just look for a school close to the house to reduce the stress on the child.
Yes, I think that's very.
You know, and then what happens when the school is over? Oh, the child must do after school, and because I'm not coming back from home, that home is home. Anyhow you look at it, home is home.
It's home. The comfort.
Yes, you know, so don't let them go to school so early, and let them come back home as soon as it's possible. Yes. So those are the things you can do to mitigate against all these illnesses that seem to just jump up anytime that school resumes. You know, so that's that about school resumption and illnesses. Related to that also is their feeding.
Okay, yes, that's a very important one I wanted to talk about.
Because when children are at home, you can really monitor them.
What they eat.
What they eat. Did they eat this? Did they finish his food? And all of that. But when they go to school, I give it to some schools, they really try to monitor and make sure that the children eat, okay? But some schools are not so fortunate to be able to monitor the child's
minders who
yes.
really care about the well-being of the children.
You know, so in those instances, the children will not eat as much as they would have eaten if they were home. And children naturally prefer play than eating. So again, the child's nutrition, we're talking about the volume now. Let's also not talk about the quality
of the food.
Yes.
I was going to ask that because we get a lot of parents put Indomie on Monday, Indomie on Tuesday, and maybe yam on Wednesday or Thursday, or maybe you can say that does only rice from Monday to Friday. So how does that also affect the child?
All of those are factors. So we need to be very intentional about the kind of food that we give children to take to school. because these things have a role to play in their level of immunity once school resumes, which has a role to play in how frequently they fall ill when school resumes. So we have to be intentional and actually have a full timetable that ensures that everything the child is taking to school is balanced diet.
Balanced diet. So we
So that,
have the proteins, the carbohydrates,
vitamins, minerals,
yeah.
you know, to make sure
Vegetables
that, yes,
inside the child.
to make sure that the child's nutrition does not suffer.
But is it possible when the child has to go to school by 6 a.m. in the morning? So you see where we have all the problems.
You know, so that's why I suggested that let's look for schools nearer home, so that at least there is less stress on both the mother or whoever is preparing the child for school, and also on the child that's prepared for school.
Okay, so on this topic, so what advice do you have for parents who don't have the option of remote job and they have to take their child to school very early and they battle with this recurring illnesses? So at what point do you think that they should really be concerned, and what do you think that they should be?
Yes. That brings me to the issue of early recognition. Before we even talk about early recognition, prevention.
Yes.
So when we're talking about illnesses in children, we want to first start with preventing it. And in the event that our preventive efforts did not work or were not sufficient, how do we recognize that there's a problem on time? And then if we recognize that there's a problem on time, what must we do on time as well?
Yes.
So that we don't have a bigger problem in our hands. So I'll talk about part of prevention is what I've talked about get them not go to school early and make sure that their nutrition is adequate and all that. So all of that's in the area of prevention. I've also talked about the hygiene, keeping the environment as clean as possible. All of that is in the area of prevention. Related to prevention also is immunizations. We must make sure that all our children are fully immunized for age.
Yes, very important.
Because it will help a lot. It helps a lot, to make sure that children are not always falling ill. Then, moving away from that now, early recognition. So if you notice, so for people whose children have to go to school, even at that young age, what are the things you look out for? Early recognition is key. This child did not eat well yesterday. The food that she took to school, she brought it back.
Finish it.
2 days ago, the same thing. That is a pointer that something is wrong. This child did not sleep well, was just tossing and turning overnight. Normally, this child just sleeps peacefully. That's a pointer that something is wrong. This child is just cranky. Any little thing, just be crying. That's another pointer that something. So you see, I've never talked about fever. I'm just talking about they have not eaten as well as they eat, they've not slept as well as they normally, they're cranky. But this child is too quiet. This child cannot be here and we know that somebody is here. It's just too quiet.
As the child becomes quiet all of a sudden.
That's important. He's just lying down. He just wants to lie down. He just wants to be carried. All of these are pointers. All of those are signs, any recognition that this child is not well. Please, if you notice any of these early signs, we have said it. Please don't consult Dr. Mugu.
No, Dr. ChatGPT.
And please don't consult Dr. My neighbor. Please. Either you consult your own family doctor or you go to the nearest hospital. Please, let somebody take a look at the child. Because there's something that they will see or hear that you may not have seen or heard. And so they'll be able to take the right action quickly. All right, so recognition, any recognition, or the child is coughing. And he coughed a little yesterday, coughed a little 2 days ago. And now it's like he's coughing like once every 1 hour. What are you waiting for? Are you waiting until the child is coughing and vomits each time the child coughs? No. By the time you're noticing that cough is there that was not there before, you see red flag.
So what about catarrh? Because catarrh seems to happen as a normal thing. So it's not like, the child always has catarrh, and then some parents will give vitamin C, keep giving multivitamin. So what do we say about catarrh?
Cough and catarrh happen frequently. And that's why we have normalized them and made them look as if it's normal. That is okay to go now. Let's go now. So and that's because a lot of times cough and catarrh, the two commonest causes, it's either a virus or it's irritation of the airway. It's one of the two many times. And that's why after a short while, it will go away. All right.
So when the viral takes course.
Yes, when it takes its course. So after a few days, it will go away. It's irritation of the airway as well. After a few days, it will go away. So cough and catarrh that has lingered for 3 days and is progressing. Please don't sit and be waiting for it. Move for help. That's what I'll say about that.
Yes.
Cough and catarrh, 3 days is there, and if 3 days is there, but it's like it's reducing, or it's just the same, you can be watching it. For 3 days and it's progressing. No.
So that
Yes, you need to look for help. Alright, so that's what I'll say about cough and catarrh.
wow.
And of course, fever. Everyone who has a child knows that once a child's body is hot, the first thing to do, they know what to do. They take off the child's clothes are removed. You put on the fan where possible, hot tepid water on the child to bring down the temperature. Give the child paracetamol, and this as first aid. Let's even calm that body down. Because if you don't do that first aid for the temperature will keep rising, and by the time the fever is so high, it makes the children very uncomfortable. They become more cranky and they generally feel unwell. And in some cases, when the temperature rises so high so quickly, some children can actually convulse, can become unconscious. So we really don't want to get to that point. So that's why fever is not what you joke about. You do that first aid for fever in the house at any time, remove the clothes, put on the fan, pour water, give paracetamol, and then at the earliest opportunity, you are seeking help. Either that day or the next day, you are seeking help, because fever is not just a one-off. Something caused the fever.
Yes.
So we need to address the cause of the fever. Paracetamol doesn't address the cause of the fever.
So what does paracetamol do? Because
it just hides the temperature for a few hours.
Okay.
You just take it down for a few hours. That's why they will tell you we were giving paracetamol and it was helping you. But after about 3 days,
it came back.
The temperature just will not go away even when you give paracetamol, because it was only hiding, it wasn't doing the purpose of seeing it. Yes. And that's the reason why we seek professional help, so that we can deal with the cause of the fever.
So you see why it's very good to talk to an expert. Because Dr. Titi has broken down so many misconceptions and so many myths, so many things that we all carried like baggages and felt like these were the solutions that we had around us. So it's always very good. You listening to us, don't forget to visit your expert. There is this dilemma that most parents or most families are going through, and it's the cost management dilemma that has led many people to start administering self-medication. Some of them use travel medical means. Some patronize unqualified doctors or people, and then some of them even use herbs in Nigeria. There's what we call the Agbo syndrome or something. So what do we do? So how do we manage this situation when it comes to child's health?
So I think that the first thing is to give people information as to the risk of self-medication, the risk of using Agbo, the risk of using, or the risk of going to quacks. I mean, people who don't have the appropriate medical training and qualification to deal with a certain problem. If you know the dangers, I think it will guide people to make the right choice. Everybody wants the best for their children. So if they're taking a decision that's potentially harmful, it's probably because they don't know what danger lies behind that decision. For example, the use of Agbo. Whilst we do not deny the fact that herbs help, they say, if a child is running temperature, just give this combination of herbs and the fever will go away. And people have been using it and they've been noticing that truly the fever goes away. So we're not denying that the Agbo, the herbs, take away the fever. But here is our concern as pediatricians. We do not quite know all the elements, the chemical elements in the Agbo. One, the optimal dose per weight of child is also not known. The possible side effects of that Agbo both short term and long term. We don't know. And the painful thing for us as pediatricians is that then some of these children will come to us at age 7 or 8 or 10 with kidney damage.
Wow.
Irreversible kidney damage.
And it's as a result of maybe the agbo that
Yes.
they're taking some years back.
So we when we have that problem of irreversible kidney damage in a child, it's irreversible.
It's irreversible.
So it's a matter of just supporting the child for as long as it's possible before the child passes on. So why go down that road if we can prevent it by not taking the herbs in the first place? Yes, go ahead.
Okay, so what affordable alternatives can be recommended? Because we know really that the economy has been somehow for some people.
So it's not even just about the agbo, even those that do self-medication, prescribe drugs for themselves and all that, because the dangers that again are inappropriate dosing or drug abuse.
Yes.
They are using a drug wrongly. All of those cumulatively affect either the child's organ systems or prolong the duration of the illness. At the end of the day, you will find out that the parents are spending more money than they would have spent if they just went to the right place on time.
Yes, because I get people coming to run some tests and they're like, oh, okay, I'm taking 5 different antibiotics. I'm like, why would you wait that long?
Yes.
Take 5 different
So the money that bought 5 different antibiotics, they could have gone to see the doctor in the nearest hospital to them.
And
it doesn't, so for people who say, oh no, I don't want to go to so hospital and the money is too much and all that, we get that as well. We understand that. That's why the public hospitals are there. That's why the health centers are there, the general hospitals are there. Those ones are very pocket friendly.
Yes.
And we're sure that you will see a competent person.
I say that
you see a competent doctor, you see a competent nurse in the health center, in the general hospital, and it is affordable.
Yeah, some of the matrons in those health centers are really experienced.
Yes.
They are really good job.
Yes, so that would be what would be my suggestion where we want to manage cost. Number 1, take the right action on time. By taking the wrong action first, you're making the problem last longer and it will cost more money to solve it at the end of the day. Number 2, go to the public health facility near you.
If you can't afford the private.
If you can't afford the private, because it's important that the health and the
specialized,
qualified trained takes a look at the child to advise on this is the proper thing to do. So that's what I would say about managing cost and health in children nowadays.
Okay, so another question I have for you, Dr. Titi, is meanwhile, thank you for doing justice to this question. Okay, so we know that a lot of children, most especially pregnant women who give birth, they come up with, when I was in labor, I had a prolonged labor, and sometimes they tie some of the experiences of maybe of the child to the experience they had during the labor time. So, is it possible? Can events of pregnancies and delivery, can it have any effects on the child's health?
That's a very good question. And the answer is yes. The effects of pregnancy, the events in pregnancy and the events during delivery can actually impact on the child's health. For example, in pregnancy, if the mother has hypertension in pregnancy that was not detected and so was not managed, the effect is that blood supply to the baby is not enough.
Wow.
So that child ends up having what we call intrauterine growth retardation. Big English. It just means that the child will not grow well. So the child is born that has not grown well inside the womb.
So is it possible for a child to grow well outside the womb?
Yes, the child will grow well. The child will grow well in terms of body and all of that, but brain development were not, but in terms of physical body growth, yes, it will catch up. But what about his brain or her brain? Or the mother that has diabetes, high blood sugar in pregnancy, again, that also can negatively impact upon the baby. So one major thing is that baby can come out as a very big baby, because there was excess sugar.
Okay.
So in being a big baby, it can lead to difficult delivery. And in a difficult delivery, that means the baby cannot come out on time and all of that because the baby is big. Eventually, by the time the baby comes out tired. And when we say baby comes out tired, it means that the baby has suffered some form of oxygen lack in the process of trying to be born. All that big grammar, what concerns the child and the family is that the child's brain gets damaged.
In that process.
Yes. So that's the way to simplify that. I don't want my child's brain damaged. Therefore, I'm going to make sure I avoid anything that can lead to difficult delivery. So that's preventing difficult delivery. Starts with going for regular antenatal in a competent place where they will check the woman's blood pressure, they will check her blood sugar, they will check her urine, they will check all of them, they will do regular scans just to make sure that everything is going well, so that any problem identified is dealt with, so that it doesn't become a risk factor for difficult delivery that can now lead to a child coming out with brain damage.
Okay, so my question is, yes, children that went through this difficult delivery, eventually, are there signs that their parents can spot? Maybe in terms of developing, are there things that they should look out for to say, okay, oh, my child escaped this brain damage, or my child did not escape? Are there things that the parents can look out for?
So, any child that has gone through a difficult delivery and the brain has suffered some form of oxygen lack or the other, means that there was some degree of brain injury. What we don't know is what was the degree of the brain injury, and will that brain recover, and how much recovery will take place. So those are the things that we don't know. However, it's important that such a child is seen by the pediatrician after birth, so that the pediatrician can educate the parents on this is what happened, this is what happened, this is what happened, and then the child then move forward, seeing baby visits, growth monitoring visits. So that child will go every month for the first year of life. Every month goes for those checkups, the doctor, the pediatrician, so that we're monitoring. Because it's not really that we're waiting for a sign to show.
So we don't necessarily need to wait
for the sign to show. Because when we're talking about brain damage, the goal is prevent it.
Yes, we don't want it to happen at all.
And then, but eventually, if it has happened and we pick it up early, then we begin to give supportive care. So that's where, and that's the value of the routine clinics, the routine visits to the clinics. That's so that if we see them, you were asking me what should the parents watch out for? Yeah, they will always watch out for milestones. Okay, but they can't on their own just interpret the milestones.
Like a child delaying to talk when the child was supposed to have talked, or walking. The milestones I believe you were referring to is maybe the child talking.
Yes, child walking. Yes. So, for example, if a child is not talking on time, we start investigating a child for not talking on time at age of 3.
So at 3, a child should start making effort to start talking already.
By 3, there is nothing being said at all, not even one word that we can say this child said mommy or daddy. Oh yes, that child was.
What about sounds? Like making sound?
Yes, so they make sounds, but the key, those sounds in themselves doesn't bother us. It is words. Can this child say a word that we can understand that this is what this child said? Of course, many parents don't wait till age 3. Because most children start talking by the time they're 18 months, 2 years, they're saying one thing or the other. So a lot of children parents are actually beginning to seek help for their children, even before the children are 3, which is okay. They can start to seek help as soon as they begin to get worried about it. And speech is a common reason why they would seek help, which is okay because there are things that can lead to support. Say people will go forward, this child is 1 year, is not yet walking. Would examine the child and see if there's a cause for that. But this issue of delayed milestones, several things can be responsible for it. And my advice generally to parents is, If you feel that your child has a delayed milestone, don't just sit in your house and be sad about it.
Seek
Sit
help.
for you.
What of in cases where maybe the child started talking and then
Stopped.
talking?
In fact, that one should run to hospital. That one should know the child was talking and suddenly
Stop talking.
That is a matter of urgency. Oh yes, that's a matter of urgency. Such a caregiver of such a child must run to the nearest hospital as quickly as possible and make that complaint so that we can begin to evaluate the child and take necessary steps. Yes.
The issue really is.
Yeah.
Thank you so much, Dr. Titi, for your invaluable insights. This conversation has truly enriched me, especially as I've gotten some revelation about so many things, so we now know better to support our children and to ensure that we raise healthy children and healthy families. And to our listeners and viewers, we hope the discussion has helped you greatly feel more confident about making informed decisions in the lives of your children. And remember to like our video, remember to share it, and remember to ask your questions beneath in the comment section. We can reach out to you. And Dr. Titi is always available. You can reach her. She is the Chief Consultant Pediatrician at Lifefort Children's Hospital at number 70 Agege Motor Road by Bishop Street Junction, Surulere, Lagos. She's on Instagram, she's on LinkedIn, she's on Facebook. She's just very close to you. All you need to do is to search for Lifefort Children's Hospital and you will find Dr. Titi. You'll find a number there to call. And the voice you'll be hearing on the other side of the telephone will be that of Dr. Titi. Thank you so much for viewing. Thank you so much for being part of Dr. Titi. Thank you so much, ma'am.
Thank you.
Healthy You Initiative is so grateful to have you in this conversation.
Thank you. Thank you. Thank you.